you have to have the patient in mind. That's what pushes you. As a surgeon, you want to fix it, get it better, and get the patient back to their lifestyle. Here you have a ligament that you might have injured. It's called the medial collateral ligament,
Okay.
as well as the meniscus that very often can be injured. We need to get some x-rays as well as an MRI and see if we can diagnose this with a little more precision. And that will determine whether we're going to treat this in a non-operative fashion versus an operative fashion. I was always interested in surgery. I didn't know what type of surgery per se, and through my medical school career, I really thought orthopedics was pretty exciting. In 27 years, I took care of the New York Knickerbockers, the Rangers, and also helped out on the women's NBA entry, the Liberty. I also had the great privilege of being a team physician for the 1992 Dream Team, the real USA basketball dream team. You have high-level athletes back playing their sports within 6 weeks at times. The one that comes to mind right away is someone who was just introduced into the Hall of Fame, Bernard King. And Bernard was actually the first NBA player, I think professional, to return to all-star status after he had an ACL reconstruction. So looking at the anterior, posterior, or coronal aspect of this knee, we're seeing maybe some osteonecrosis on this knee. If we look over here laterally on the femur, we're seeing maybe an extension of the osteonecrosis with a... I think you have to love it, and probably the biggest variable today is surgical expertise. The prostheses have gotten to the point where if put in correctly, they should function correctly, and that's where the surgeon comes in. You have people returning to their activities within days, if not weeks. Athletes, professional, recreational, intercollegiate, back playing their sports within 6 weeks at times. The horizon just seems to be getting bigger and bigger as far as what we can accomplish.